Good morning, student. Today we are going to study about anti-mycobacterium drugs. Before starting with anti-mycobacterium drugs, we should have knowledge about what is mycobacterium and what are the disease this bacteria can cause. So, Mycobacterium is a genus of actinobacteria. Given its own family, Mycobacteriaceae, over 190 species are recognized in this genus. This genus includes pathogens known to cause serious disease in mammals, including the word mycobacterium is derived from Greek word. The prefix myco means fungus, and it has been observed that it grow in a mold like fashion on the surface of clusters. It is acid fast and cannot be stained by gram stain procedure. It includes majorly two diseases named as Mycobacterium tuberculosis, which is responsible of causing tuberculosis, and another Mycobacterium species which is highly pathogens to mammals is Mycobacterium leprae, which is responsible of causing leprosy. So today in this lecture we will focus on anti-tubercular drugs. So anti-tubercular drugs comes under the class of antimycobacterial drugs. Tuberculosis is often termed as TB. It is caused by a bacteria named as Mycobacterium
Before starting
tuberculosis.
with antitubercular
And there is one
agents
more
or
bacteria
drugs,
which is
we should
responsible
have
for tuberculosis
knowledge
is
about
Mycobacterium
tuberculosis.
bovis, which bacteria
It
is
contains
responsible for causing
unusual cell wall,
tuberculosis.
and
Cell wall
how
of
it is
bacteria
transmitted
contain high
from one
amount of
person
lipid
to
content.
another.
Because of this
What are the
high
risk
amount of
factor
lipid
involved,
content,
and what are the different
it
drugs that
is
are used
resistant to
for the
alcohol,
treatment of
acids,
TB?
and some of the disinfectant. This bacteria mainly affect lungs tissues, but it can also affect CNS, kidney, and other part of body also. According to the static, it is an infectious disease and 2 million people have been suffering from the world population. About 10,000 about 1000 people being died daily in India due to TB. Tuberculosis is a communicable disease. It spread from one person to another through nasal droplet by sneezing or cough. It is generally spread in crowded area, and person who have HIV have a increased risk of this disease, as HIV person have less immune system or they have lack of immunity. Patient such as with diabetes, chronic lung disease, chronic renal disease are also susceptible to TB. Or we can say that they can have more chances to infected by this bacteria because they have lack of immunity. When we talk about symptoms or sign of TB, they include an unproductive cough, feeling tiredness all the time, weight loss, loss of appetite, night sweating, fever, cough in the blood, fatigue. Diagnosis tests for TB include chest X-ray and sputum test. This is an image showing active pulmonary tuberculosis. As I mentioned earlier in the slide, that Mycobacterium tuberculosis can also affect other site also, other than lungs, that include brain, bone, liver, kidney, lymph nodes. I have already mentioned about the diagnostic studies for tuberculosis, which include chest X-ray, preparation of smear from the sputum, and bacteriological studies. This is a typical diagram which depicts the mycobacterial cell wall. The cell wall of mycobacterial bacteria contain mycolic acid, which is an essential target for anti-tubercular drugs. Next come to the treatment of tuberculosis. As administration of single dose often lead to the development of bacterial population to resist for that particular drug. To prevent these particular problems, tuberculosis is treated by multiple drugs as to prevent resistance. So basically anti-tubercular drugs are the agent which are used for the treatment of tuberculosis. Now next is the classification of anti-tubercular drugs. First line drugs include isoniazide, rifampicin, ethambutol, pyrazinamide and streptomycin. These drugs are of high efficacy with low toxicity. Next are the second line drugs. These include ciprofloxacin, ofloxacin, levofloxacin, clarithromycin, azithromycin. Now we will learn about in details about isoniazide. Isoniazide, commonly known as nicotinic acid hydrazide. If we look at the chemical structure of isoniazide, it contains pyridine 4 carbohydrazide. The pyridine ring is attached to the carbohydrazide. If we talk about the physical properties, it occurs as colorless crystal or white crystalline powder. It is odorless with sweet taste followed by bitter taste. It is soluble in water. Now, if we talk about chemical properties of isoniazide, when isoniazide is treated with bromine water in the presence of acidic medium, it forms quantitatively it convert into isonicotinic acid and nitrogen gas is evolved. Here is the reaction in which nicotinic acid is formed. And when isoniazide is treated with benzene sulfonyl chloride, it converts into its benzene sulfonyl derivative. The compound formed is an intermediate for the synthesis of gamma nicotine aldehyde thiosemicarbazones. This is the reaction involved. Now if we talk about stability and storage, isonicotinic acid or isoniazide when exposed to light, it get affected. Therefore, it should be stored in light resistance container. It is also prevented from moisture. Therefore, the container should be tightly closed. Here are some uses. It is used for pulmonary TB, extra pulmonary TB, and it is also used for genitourinary infection, Lupus vulgaris. Lupus vulgaris is also a type of a TB which generally occur on skin. Next, if we talk about its pharmaceutical preparation, it comes in syrup form, tablets, as gargles, powder, and injections. And here are some brand names of Isoniazide. Now, the next drug is para-amino salicylic acid, which is commonly called as PAS. If we talk about its chemical structure, it is parabenzoic acid, and on other side amino group is attached, and on the second position hydroxy group is attached. So it is commonly called as 4-amino 2-hydroxy benzoic acid. Now, if we look at the physical property, it occurs as yellowish white crystal. It is odorless and has slight acidic in taste. It is slightly soluble in water, but soluble in alkalis and dilute nitric acid. Its hydrochloride and sulfate salt are soluble in water. That means जो इसका सॉल्ट फॉर्म होता है सल्फेट और HCl हाइड्रोक्लोराइड का, वो वाटर में सॉल्युबल होता है. और अगर हम सोडियम सॉल्ट की बात करें तो वो तो वेरी सॉल्युबल इन वाटर है. सो ये इसके फिजिकल प्रॉपर्टीज़ थी. अब नेक्स्ट है पैरा अमीनो बेंजोइक एसिड की केमिकल प्रॉपर्टीज़. सो ये इसकी केमिकल प्रॉपर्टीज़ हैं जिसमें ये डाइजोटाइजेशन रिएक्शन शो करता है. तो जब पैरा अमीनो सैलिसिलिक एसिड को ट्रीट करेंगे सोडियम नाइट्रेट के साथ HCl के प्रेजेंस में एट 0 to 10 डिग्री सेल्सियस टेम्परेचर, द प्राइमरी अमीनो ग्रुप इज़ कन्वर्ट टू डाइजो ग्रुप. अगर हम यहाँ पे रिएक्शन में देखें तो ये डाइजोटाइजेशन रिएक्शन है. और ये रिएक्शन जो है ये इसके एसे के लिए यानी कि परसेंटेज प्योरिटी के लिए भी यूज़ होता है टू डिटरमाइन इट्स परसेंटेज प्योरिटी. अगर उसके बाद नेक्स्ट देखें पैरा अमीनो सैलिसिलिक एसिड को अगर हम हीट करते हैं सोडा लाइम के साथ तो ये डीकार्बोक्सिलेशन रिएक्शन शो करता है. इट मीन्स इट गिव्स मेटा अमीनोफिनॉल. अब जो थर्ड रिएक्शन है उसके पहले हमें इसके एक साइड इफ़ेक्ट के बारे में नॉलेज होनी चाहिए. अगर हम पैरा अमीनो सैलिसिलिक एसिड को ओरल डोसेज फॉर्म में लेंगे तो ये गैस्ट्रिक इरिटेशन कॉज करता है. इस वजह से इसको हम डायरेक्टली नहीं ले सकते, इसलिए इसको हम एस्टर के फॉर्म में कन्वर्ट करते हैं. अब अगर हमें इसको एस्टर में कन्वर्ट करना है तो हम इसको ट्रीट करेंगे अल्कोहल के साथ इन द प्रेजेंस ऑफ डाइल्यूट एसिड. जब इसको अल्कोहल के साथ ट्रीट किया जाएगा इन द प्रेजेंस ऑफ सल्फ्यूरिक एसिड तो जो कार्बोक्सिलिक ग्रुप है वो एस्टर में कन्वर्ट हो जाएगा. या फिर हम इसमें कर सकते हैं इसको बेंजोइल क्लोराइड के साथ ट्रीट करें और फिर इसका एन एसाइल डेरिवेटिव फॉर्म हो जाएगा. यहाँ पे ये रिएक्शन दी हुई है जिसमें एस्टर और असाइल डेरिवेटिव्स बनाया हुआ है पैरा अमीनो सैलिसिलिक एसिड का. इट इज़ ऑल्सो ऑक्सीडाइज्ड बाय एयर और ऑक्सीजन एंड फॉर्मेशन ऑफ ब्राउन और ब्लैक कलर पिगमेंट अकर्स. अगर हम इसके स्टेबिलिटी और स्टोरेज की बात करें इट डार्कन ऑन एक्सपोजर टू एयर एंड लाइट. इसलिए इसको टाइटली क्लोज्ड एयर टाइट कंटेनर्स में स्टोर करना चाहिए. इट इज़ ऑल्सो अफेक्टेड बाय लाइट, देयरफॉर द कंटेनर मस्ट बी लाइट रेजिस्टेंस. अगर हम इसके यूजेस की बात करें, इट इज़ यूज फॉर द ट्रीटमेंट ऑफ टीबी. It is generally given in the combination with isoniazide or streptomycin. It is now replaced by more effective and well tolerated anti-TB drugs like rifampicin and ethambutol. अगर हम इसके फार्मास्यूटिकल फॉर्मुलेशंस की बात करें, सो इट कम एज टैबलेट. It is also comes as capsules, and here are some brand names of para-amino salicylic acid, that means PAS. Now next drug is pyrazinamide. If we talk about chemistry of pyrazinamide, it contains pyrazine ring, and at second position of pyrazine ring carboxamide group is attached. If we look at the physical properties, it occurs as white crystalline powder. It has no odor and contains slightly bitter taste. It is sparingly soluble in water, but soluble in ether and chloroform. Pyrazinamide is affected by moisture and water content. Therefore, it should be stored in tightly closed container. If we talk about uses, so it is used as tubercular static agent. That means it inhibits the growth of Mycobacterium tuberculosis. It is also active against strains which are resistant to other antitubercular agents. Now, if we talk about different formulations of pyrazinamide, it comes in tablet form, and here are some brand names for pyrazinamides. Thank you. I hope this lecture is beneficial for you.